And I would like to invite Professor Michal Miovský. Michal is Professor of Clinical Psychology at the Czech University in Prague, and also head of the Addiction Department there, starting a special education in addiction, which is a quite unique thing, I think, not only in Prague but internationally, and also former president of the editors of the addiction journals, which as being editor-in-chief or co-editor-in-chief now of the Czechish Journal of Addiction. So in many positions he has a view on education issues and treatment issues regarding addiction. So I'm really curious about what you will tell to us tonight.
Thank you very much, Jolt. I have one. Thanks so much. That's fantastic to see so many people Friday afternoon. You know, my expectation was that I will see 5 or 10 participants. That's great. It means that it's probably something interesting for you, hopefully. I will speak about some new opportunities in our field, and I will be balancing at the edge between psychology and addiction field. And you know, we usually it's not so obvious to speak and to think about addiction as a unique field, but something happened, something very special happened, and we can see observing and emerging completely new unique field like psychology, like public health or mental health concept. At the same time, I have to start and I have to open my presentation that still we are not enough successful in translating science into the practice. It means in reality that we are using many non-evidence-based interventions in prevention and treatment. But the problem is that if these interventions failed, people don't trust us. And that's probably a very logical consequence. On the other hand, that's the problem that we have no under control everything, and we have to work and we have to deal with it. At the same time, probably what is consequence and what is need is to improve our dialogue between academic sphere, service providers, and the public and the people in the field. At the same time, addictions are not still recognized as a unique field. As I mentioned before, we usually think about addiction psychology, addiction psychiatry, addiction social work. But at the same time, at this moment, we can speak about addictions as a really unique and separate scientific field where we can observe some new areas. And at the same time, we can find also completely new study programs established on many universities around the world. I mean that at this moment you can study psychology, and after your psychological studies you can continue on in addictions as your specialization. But on some universities you can study bachelor, master or Ph.D. program specifically focused on addictions, and that I will speak about this area today. At the same time, if we are speaking about unique field, about a new scientific area, we have to speak about national and international infrastructure. It means specific institutions creating the field. In addictions, it's not so new as we think and as we usually speak, because many addiction-specific and specialty institutions are emerging through last 1.5 century. It means that in second half of 19th century, we can find some first addiction-specific institutions. It means, by the way, it's at the same time like first psychological institutions. At the same time, for instance, in 1994, in the United Kingdom, it's not only time of establishing national addiction society, it's also the first time of our first addiction-specific addiction specialty journal, Addictions, what is our flagship until today. We can recognize many other institutions in the field, addiction-specific institutions, and we can speak about addiction research centers, addiction specialty journals, addiction-focused professional societies, national and international. We have also addiction-specific libraries. By the way, we have many addiction libraries in the United States and some few in Europe. And we have, as I mentioned before, also addiction-focused addiction and training programs. You can see that the emerging of the field is possibly recognized much easier in second half of 20th century. And we can start with addiction specialty journals, and that's exponential growing of new journals specifically dedicated to addictions. And today we can recognize more than 130 addiction-specific journals around the world. And there are probably many others, but we have a problem to recognize them because of language barriers. At the same time, we can see that there is the parallel process in the area of research centers, and we have many research centers also located in Europe. By the way, we established also International Society of Addiction Journals, and as Jolt mentioned before, all of our journals are in this association. Growing addiction specialty societies. You have your own Hungary National Society. We have also a National Society in Czech Republic. By the way, we have 4 specific addiction societies in Czech Republic. One is dedicated to addiction psychiatry, second to interdisciplinary approach to addictions, the specific society. One is dedicated to our graduates. I will speak about our graduates later from our study programs, and one is dedicated to prevention, addiction prevention. We can recognize also first national and international societies. As I mentioned before, you probably know these societies before. And just recently, we have this international body, International Society for Substance Use Professionals, and we try to invite people from many different areas. I mean, psychologists, social workers, and also people graduated from addiction programs. At the same time, as I mentioned before, we can recognize first addiction-specific academic degree programs on a couple of universities. The process has started almost 40 years ago, and probably the oldest program in Europe was established on Trinity College in Dublin. But at the first time, I have to specify what we are talking about, because sometimes we have just some specific trainings focus on addictions. You probably have some courses in addictions on your psychology department. We have many similar products on study programs for nurses, social workers, and others. At the same time, we have some summer schools. By the way, in Europe, we have a very iconic program based in Amsterdam, and every year they are inviting people around the world with special focus on harm reduction and risk reduction activities, and it's a very successful concept of summer school on Amsterdam University. Our flagship, as I mentioned, are comprehensive academic degree programs, bachelor, master, and Ph.D. programs focused on addictions. And at the same time, we have many activities in this area for people graduated from different areas, from different fields, and we have lifelong education programs. As I mentioned, this is probably the oldest program in Europe, and this is paper by Shane Butler from Trinity College in Dublin, and you can see that this program was established in 1983. The second oldest program is located in Barcelona, University in Barcelona, what was established just 3 years later after this first program. Actually, we didn't know, and we have many national activities like that. This is example from United Kingdom. At the beginning, we didn't know how many programs are operating by different universities in Europe. And that was the question that we needed to know something more about it. And we conducted very simple study, focus on university programs and try to identify how many programs are operated on European universities. And we found 34 academic degree programs in European countries. You can see the structure. Some of these programs, and majority of these programs, are operating in United Kingdom. That's the reason why they have these academic titles. And as you can see, we can found and recognize 5 PhD programs operating on some universities in Europe. Some of these universities are providing also clinical training and internship. It means that they train the people for clinical field. Some of them are only theoretical oriented, for instance, in public health or mental health area, focus on addictions. If you would like to know more about it, we published it 3 years ago in journal Drugs, Education, Prevention and Policy. At the same time, and it was a little bit tricky to compare Europe and US, and we conducted the same study on US universities, and the findings are really surprising because in the US, in the United States, they are operating 10 times higher number of academic degree programs than in Europe. It means that we found almost 400 academic degree programs operated by US universities with special focus on addictions. By the way, only in California, you can find more addiction programs than in all European countries together. By the way, we are finishing this mapping in Asia, and in Asian countries, we have more addiction programs than in Europe. It's a really fascinating process, and it's something where I can say that we are sleeping, really. By the way, we found wonderful programs in Africa. In Nairobi, they have wonderful master program in addictions on Kenyatta University, a really high-quality master program. In Cape Town, we found another one, really perfect and really highly sophisticated programs. If you would like to know more about US programs, it was also published. And right now we have under review mapping of Asian and African programs. So it means that it's perfect time for establishing association of universities with this program because we didn't know about each other, we didn't have a collaboration, and at the same time that's perfect opportunity for exchange of teachers, of students and things like that. We established this association in 2016, and of course we have a very expectable profile focus on networking development, inviting more students and making this field more attractive, and at the same time we try to establish international networking what can improve our situation in terms of science and research and creating joint projects and supporting collaboration like we already have with your university and other universities in Europe. At the same time, we try to also advocate for this field because in many countries we have a problem with enough quality professionals for service providers, and we try to promote that if we would like to do something for our patients, we have to train and create much better professionals and highly educated professionals than before. We have first international curricula focus on addictions, and I should to start with universal treatment curricula, what is very simple curricula, and it's possible to adopt it also for psychological study programs like universal prevention curricula. It's the second area, and all of these curricula are free of charge. It means that we are providing this curricula for any universities, and doesn't matter who will seek and who will apply for this curricula. So you can see many national adoptions, translation of this curricula, and we try to promote it and offer for students and for teachers from different universities around the world. At this moment, we have many member universities around the world, and I will speak about it a little bit later. But first, I will speak about my own university, and we are operating addiction program on my faculty for more than 15 years, and we have developed our own curriculum at the beginning, and when we found that there is something like international curriculum, we have decided to adopt it and implement it into our study programs. At this moment, we have a bachelor program with 150, 170 students. That's 3 years program. We have a master program. It's almost 100 students. And we have also international Ph.D. program, what is operated in English language. Bachelor and master program is provided only in Czech language, but we have accreditation for international master program, and we will open it in 2 years, hopefully. If you would like to know more about it, there are papers that are available about these programs from former evaluations. I promised to mention how many members we already have, and we have almost 200 member universities, because our membership, we have no individual membership, we have an institutional membership, and doesn't matter that we have almost 600 individuals, our membership is for institutions, and it means that our members are universities as academic institutions, and you have a link here and receive more information from our websites. This is our websites. Yeah, and what to say as a conclusion? And probably I should start with expected question if this new qualification, this new field is something what can be threatening psychology, because I am receiving permanently questions like that from our clinical psychologists, and my original background is clinical psychology, and some of my colleagues suspicious me that that's something like a heresy in psychology, but I'm not sure if it's something wrong and something against the psychology, because it's something what can make our field much more rich. At the same time, psychology is also a very interdisciplinary based field, like addiction science, like public health, like mental health. And I think that it's about collaboration, it's about new opportunities for psychologists and creating our partnership. At the same time, interdisciplinary approach is still relevant. What does it mean? It means that there is no possible to be also a biomedical oriented professional or only social oriented professional in addictions. We need interdisciplinary approach, and it means that there is still very clear profile, very clear position for clinical psychologists, and there is no overlap in many areas. For instance, in diagnostic procedures and diagnostic methods, that's still dominant part for psychologists, and there is no possible to expect any overlap with addiction professionals graduating from special programs. At the same time, I think that great opportunity is to using the curricula, addiction curricula for our study programs in psychology. You know, probably some of you will work as a professionals in prevention. That's just starting field, and in many countries at this moment we have no real working positions in prevention. That's the future. And many people probably will work in this area. And as a psychologist, we have a perfect background, perfect training for doing really highly professional prevention. By the way, in many countries in Europe, we are using interventions that are not tested. Our Italian colleagues provided and conducted research focus on prevention interventions, and they found that on Italian schools they are using 98% prevention interventions without any feedback, without any evaluation, without any information about these interventions, about safety, about effectiveness, completely zero information, just 2%. No, that's reality, and not only in Italy. Italy is a relatively rich country, and we have very similar situation in many other countries, and not only in Europe. In the US, it's completely undercopy situation. That's completely same. Despite the fact, and this is the gap, despite the fact that we have wonderful science in prevention, Our colleagues in the US established first international society in 1993, SPR, Society for Prevention Research. Really highly sophisticated society with wonderful journal, Prevention Science. It's one of the top journal in the world. We have perfect science, perfect research in prevention, but it's not translated into the practice. That's the problem. And again, wonderful opportunity for our teams, for our universities, is using this curricula and training psychologists, special pedagogists, and other professionals in addiction interventions. By the way, medical students and medical faculties lost interest in addictions. Can you guess how many hours we are trained medical students in addictions on our faculty? And we are probably the biggest and the oldest medical faculty in Central Europe. And we have 4,000 students in general medicine. Can you guess how many hours we are trained in 6 years? You know, the curriculum is for 6 years in general medicine. Can you guess? 8 hours. 8 hours in 6 years. That's picture of many medical faculties, not only in my country. That very similar picture is in other countries. Despite the fact that we conducted 20 years ago European-wide project focused on medical faculties with recommendation have 2 weeks of special training in addictions for medical students. The reality is that usually we have 1 or 2 days in 6 years. What's the future for addiction psychology? That's another relevant question. I think that we can expect very significant impact on graduate, undergraduate, and postgraduate level in terms of adapting this curricula and spreading this curricula into the wider psychological community. Maybe we can expect also double qualification. By the way, I have this double qualification. I'm clinical psychologist, and I'm also in Czech Republic, we call this profession addictologist, and they are licensed like clinical psychologists or nurses, and it means that they are also paramedical professionals, and I have this double qualification. And I think that it's something expectable for the future. We have nurses in our study program, we have some social workers, and I think that for many psychologists it can be a great opportunity to have both qualifications and mix it together. On the other hand, I will finish my presentation with this wish and this comment that for all of these improvements it's necessary to be enough open and to allow this dialogue and to seek for this dialogue. That's probably prerequisite for anything like that. Thank you very much.
Thanks very much. I don't have to ask if anyone.
Yes, I want to talk about the difference between people who work on addiction and clinical psychologists, and that would be a negative comment, and then I'll say something positive. I can give an example of an alcoholic who came to us for treatment, and she went earlier to the National Health Service. She was assigned a clinical psychologist. And the clinical psychologist asked her, what is your problem? And she says, a bottle of vodka every 2 days. And she says, okay, you stop drinking, and then you come back to me, and then we can talk. And she told her, well, if I could stop, I wouldn't come back to you at all.
Yeah.
So she, and this is a typical case because some psychologists don't want to work, they don't understand addiction, and they don't want to work with people who are either stoned or drinking too much, whatever. And so this is an issue of difference because, for example, working with lots of people who are addicted to cannabis and trying to get them to stop, on the way they come for treatment when they are stoned and there's nobody to talk to, and I wouldn't throw them away from treatment. So this is one major obstacle that is different. About something positive is that we have dual diagnosis, and in most cases in addiction we see also depression, anxiety. So this is a fruitful place for dialogue when you can see the common mechanisms of what generally clinical psychologists or psychiatrists are working and addiction people working as well. So.
Thanks so much for both comments. Yeah, we have many probably set stories and perspectives in observing of clinical psychology in the context of addictions, or vice versa. Yeah, we became probably too conservative. And at the same time, we are probably too highly educated specialists as a clinical psychologist that we, in addiction specifically, we lost the contact with reality. Yeah, that's probably very common reaction and very normal reaction of many psychologists, that if patients came to their work, yes, first of all, you have to stop. But on the other hand, we have less and less patients in psychiatry without this comorbidity. You know, practically, I would like to say that we have more and more patients with comorbidity in addictions with all other diagnoses. By the way, can you guess, can you imagine the people with psychosis without smoking tobacco? It's almost 100%. By the way, we have extinguished in our departments, probably you have something like that too, that our patients are allowed to smoke in psychiatric hospitals. Other departments have no this special rule. It means that probably we have to approach again much closely to this field and invite clinical psychologists as highly educated professionals into the addictions, and probably to train psychologists much better to collaborate with other professionals in team. By the way, I think that without clinical diagnosis and diagnostic procedure, we are not able to provide the full service. It means that psychologists have very good position in the team. But what is necessary is invite them and promote this position, that it's something attractive for their future and for their career pathway.
Thank you. In this context, I think that addiction is a very multidisciplinary field. So there's a risk in trying to separate it, like taking out the heart from the body. Because, like you said, in prevention, in order to offer quality prevention, you have to understand the root of the problem. For example, it's good to be a clinical psychologist trained fully in understanding the psychology and the psychiatry behind a certain disorder, and then to qualify as a specialist in addiction. Like doctors, for example, they go into a course of general medicine and they specialize in surgery, gynecology, neurology, etc. So there's a risk not to have the parent discipline psychology, because then we are ending up like pharmacology. Pharmacology aims to new drugs treating the symptom, but doesn't cure. Yeah. No drugs cure, actually. And there are now scientists who believe that most of the physical causes of disease have a psychological root. So I think while attracting the attention to the importance of training specialists in the field of addictology, we need psychologists and medical personnel trained specialists as addictologists.
Thanks so much for this comment. That's perfect. My understanding to this process and establishing these special trainings, that it's something what can help to integrate the field. And I mean, we are thinking and wondering about the addictologists and people graduated from this program as something what can integrate all these professions together into the one frame, and at the same time what can help to create the joint language, the sharing, the frame. It means that there is much more clear and much better define what is addiction field and what is good to know as a psychologist about addictions, what is good to know about addictions as a medical doctor, as a social worker, but there is quite clear and more clear what's the core, what we have to share together. And in my eyes and my understanding is that these addiction programs can help to support this integrative or integrative process. And in my eyes, it will be really wrong and bad if it will be about separation and if it will create more barriers in communication with other professionals. Our expectation and our plan is to help and support integrative process in addictions. On the other hand, I have to say from opposite side that it can be perceived as a reaction of lack of situation in professionals in addictions generally. We have no enough addiction psychiatrists, we have no enough addiction psychologists, we have no enough other professionals in addiction field because it's not enough attractive for these professionals and for these professions. It means that we have to refresh this field and invite these people because, by the way, you provided wonderful example of very interesting studies. We are investing incredible money into the epigenetic research of alcoholism and other areas. And I think that we are exactly at the threshold of refreshing addiction fields and making this field much more attractive for other professionals, hopefully.
Yeah, you mentioned that there is a gap and we need to combine, we need to integrate, right? My question is related to best practices. I'm thinking about, you did this research on the universities. Did you see anywhere, or you have any data that this gap is not so huge somewhere else? Maybe we can use that best practice. Or if you just mentioned we don't have enough specialists here, but you also showed the number that how many universities or high the numbers are at US. So is there maybe a solution there already?
Yeah, thanks so much. That's very relevant and very good question. I will be really open. Just 5 or 6 years ago, actually, we didn't know how many universities already have this program. And at this moment, we know how many universities have this program, but we know completely nothing about these programs. I mean that we are just searching what's the content, what's the quality. By the way, we have international curricula, but these curricula represent just the core of the study programs. It means that we are providing many other things, many other trainings for our students, and there is no comparative study. And there is no evidence if higher trained and higher professionality of these professionals have a real impact on quality of services. If we can expect higher effectiveness of our services, this evidence is not available. It means that that's the challenge. Absolutely, that's the challenge. And at the same time, this is evidence-based in addiction, training, and education. At this moment, we have just first curricula, what were already tested on some universities, but the second step is testing of these professionals and this approach into the real practice. That's the future. And at this moment, we have no this evidence, just very selective data, but I think that it's not possible to interpret it and use it in reality. Again, that's just emerging process, and psychology needed more than 100 years for developing curricula in psychology. It's not so many years that we have European curricula in psychology. It's just 15 or something like that years. And this field is really young at the university or academic level. It means that it will need probably 3 decades as minimum for developing something like that and testing it in reality. But it's a very good question. Thank you.
Hello. My question is around the issue or the topic of teacher education. I'm a teacher and I'm from South Africa. And as a teacher, I've been exposed to, children using drugs, and I'm quite aware of the impact of drugs on children. Do you think that it would be important to kind of integrate this discipline in teacher education? You spoke of multidisciplinary approach, interdisciplinary approach, integration. So personally, I think that, teachers have often been left out of many, equations. So what if this time maybe you take it further and maybe to make the discipline popular also? Again, also you spoke about making it, known to people, to advertise it. What if you also, integrate with teacher education?
Again, integrate into the teacher education. Absolutely. That's probably, I have to go back here. Just give me a minute and I will find it. Yeah, this is Universal Prevention Curricula. That's our flagship towards pedagogical faculties and education programs. Maybe I should start with a much broader explanation. Before, historically, we didn't have enough clear idea about prevention field and about prevention interventions. And it means that on many pedagogical faculties, we are training and teaching not enough evidence-based thing in terms of prevention, and at the same time, it's not about modern and tested interventions. And not only in Asia or Africa, we are speaking also about European universities where we need to support using something like that. And by the way, this curricula, it's in total, it has 800 hours. It means that it's very comprehensive curriculum, and it's it means that it's perfectly fit for master or PhD programs. And our plan is to support adapting prevention curricula, UPC, this one, for pedagogical faculties. For instance, in Europe, we adapted for pedagogical faculties this complex curricula into a much more compressed version. It's about 30, 40 hours, something like that. It's about introduction to prevention. And we try to promote this model for pedagogical faculties for starting with something in this area. Of course, we have many trainings like with leisure time activities, like life skills and things like that, but not with specific interventions in prevention. Not only drug prevention, I mean general prevention of risk behavior. And that's a big challenge and big problem. At the same time, I know at this moment about minimum 3 or 4 faculties in Africa what are seeking and trying to adapt this curriculum into the pregraduate and graduate programs. And only in Nigeria, we have 12 universities trying to adopt this curricula on Nigerian programs. It means that, again, that's just beginning, and hopefully it will develop fastly. The problem at this moment is probably financial limit. We are, for instance, our association is sponsored by US government, what is very unexpected situation. And 5 years ago, if somebody tell me about something like that, I will respond that it's totally crazy idea. But really, our sponsor and donor of these activities is US government, and they help to establish this association of universities. And by the way, they are sponsoring many trainings for academics from Latin American universities, African universities, Asian universities for adapting and implementing this curricula into their universities. And without this help, I can't imagine this work. By the way, we have zero support from any European institutions and donors. That's a really incredible situation that we have to apply for money in US for this international work. And at the same time, we try to identify alternative sources for this work, but in Europe, that's completely zero. We are on the grass level. Sorry about saying that, but again, that's that's reality.
Thank you very much. I really enjoyed your presentation. Just to add a few things, that this universal prevention curriculum, you probably know that there is a European adaptation of it.
Yep.
And at the moment there is an EU-funded project on this European universal prevention curriculum.
Yep. It will be launched on a Lisbon Addiction Conference, and at this moment, yesterday, we agreed with the final version in English.
Yeah, but what I'm saying is that there is a project which would like to
we were participated country on this project.
Adaptation, and there will be a training course starting next week in Lisbon, which is trying to train so-called master trainers who will be able to train the trainers courses. And we are participating in this project, and it will be evaluated. By the way, the trainer.
You have a national adaptation,
Pardon?
You have a national adaptation
of
this.
We are participating in this EU-funded project together with 7 other countries.
We participated on this project. On the European adaptation. Czech Republic.
It is the ASAP project.
ISAP.
So it is the AS.
It's a different project. Oh,
so that's
I didn't know.
I wanted to say that
there
are many parallel initiatives in this field, and it's good to know about each other because it's important that there is an adaptation, ASAP.
EU UPC.
Of the European prevention curriculum. And the other thing which I wanted to say that adaptation, which is different from the one which you are speaking about and which will be launched in Lisbon, at the Lisbon Addiction Conference, is especially for those prevention professionals or for those people who would like to become a prevention professional and working at school level or in prevention service providers. So it is not to obtain an academic degree, but to be able to work as a prevention professional. And it seems to be very important because within the context of this project, we are doing a so-called prevention system analysis. And within that, we were approaching the different EU member states to find out what kind of prevention systems they are having. And it is a so-called policy analysis. And 20 of the 28 countries replied to our questionnaire, the National Drugs Coordination units, and it turned out there was a question about the educational prerequisites of being in decision-making position or being a professional in the field. And you can guess what was the percentage of those where there was a definite criteria for having a prevention-specific education of those who are in decision-making position.
Probably really low.
Very low, very low. So you are absolutely right that even at decision-making level, there are no requirements for being qualified in prevention science or in addictions-related fields. And the other issue which I also wanted to mention that, by the way, information regarding best practice is available because if we go to the EMCDDA's website, there are different type of data sets from which we can understand which are those interventions which are tested and properly evaluated.
Thank you very much. I didn't know about the separate projects. We just finished with the European adaptation and we will launch it. And it is sponsored by EU, really? DigiJust, oh. Because we have for European adaptation, we had support from the Brussels. Super. Thanks so much. Great. It means that we have more than one activity in Europe. Perfect. Thank you very much.
First of all, thank you for your talk. I want to ask a specific question. A lot of those addiction programs focus on the major addictions like drug abuse, alcoholism, gambling. But how much do you look into the new addictions called smartphone addiction and the minor addictions like sex addiction? Is that a point in your case as well? And how much is that in prevention?
Thank you very much. It's the same question what we were talking about before. At this moment, we don't know. We know just about some universities what integrated these issues into the study programs. For instance, my university, we have an integrative concept including behavioral addictions. But many universities are focused just on substance use issues or substance use addictions. That's a big problem probably for the future, because from the first surveys what we conducted, we see that for students or potential students, it's much more attractive if these programs are broader. It means that they have more opportunities for their career pathway for the future, and at the same time, yes, behavioral addictions, it is future for addictions generally, and means probably more opportunities than before and than in traditional way in addictions. It means that I think and I believe that more and more universities will integrate these issues into the study programs in the future. But at this moment, I'm not able to respond because we don't know how many of these universities already integrated these issues into the study program. Wow, it's many questions. Super. Thanks so much.
No, thank you. And you mentioned before that there is a misunderstanding between addiction treatment and addiction prevention. So what would be another misconceptions on addiction that would harm the direct treatment of people who would seek for our help?
You mean what's behind this imbalance, or?
More like what would be other misunderstandings on the whole field?
Aha, other misunderstandings. Oh. Yeah, this imbalance is probably one. Probably another misunderstanding is something what was mentioned before. That is comorbidities. You know, there is no possible to speak only about one separate addiction or one separate problem. And I think that many professionals working with the idea that it's possible to separate it. And you know, we have to go to 19th century and Eugen Bleuler and other psychiatrists, great psychiatrists, that usually people have more troubles than one. And that's normal, that's expectable, but still many professionals in reality is thinking that if you have people with substance use disorders, that it's something what is separated from other troubles. And I think that in the future, for this misunderstanding, it's necessary to improve awareness in broader auditorium of professionals that all of these troubles are linked together, and that's not simple coincidence. That's probably another example. But very interesting, another example for me is about age perspective. Addiction field was created on the concept that it's problem of adults. But today we are testing of services for kids and adolescents. By the way, we conducted first pilot program in 2015 in Czech Republic, and I have this service on our clinic, and it's perfectly sustainable, and we have many patients. And many of my colleagues expected that no, that it's about just behavioral troubles and it's about some lack of support by parents and things like that. No, they have a serious addiction troubles. And that's one example. And from the opposite side, we have no special services for elderly people, 60 plus. No specialized services for these people, despite the fact that not all people die before 60. Fortunately, no. It means that we have many people, 60 plus, with addiction disorders. And what is logical consequence is to create special services what will be appropriate for these people, what will be fit for their needs. And actually, we don't have these services. And that's another probably wrong concept, misunderstanding that this is only problem of teenagers or adult people. No, it's also a problem of people who are a little bit older. And we have many other misunderstandings in the field. And by the way, if we will create more services for older people, it means that we will create more working positions. We will create more specific services where more professionals, young professionals can work. That's in my eyes, and sorry about saying it, but in my eyes, addiction fields from perspective of professional services and your potential working positions is about only increasing, and will be probably one of the most attractive area in the future in terms of increasing working positions and combining neurological perspective and other biomedical perspectives with social work, with religious issues and things like that. Can you tell me, was there another field where you can combine all this perspective together?
Thank you very much for your presentation. I was wondering if the number of programs in it about addiction has the parallel with population of individuals with addiction. Like in USA, you said there are more programs. Is it because they have higher population of addiction, or in Europe?
You mean if there is a relationship between...
if there's a relationship between the number of programs about addiction and the population?
I'm afraid not.
Or it's
no.
more about the organization?
I think that the core and the answer is that it's about broader awareness of this problem and this opportunity to have this special program. And there is no link with number of inhabitants and in population.
Okay, so the number is not about...
No. You know, Europe, of course, it's questionable if and how much, but if it is comparable with US. And if they have a 10 times higher number of these programs, it's not about population, it's about awareness of the problem. And you know, US population and US society, they are very practically oriented. And you can believe and you can trust that they will not develop programs like that without very practical reason. I mean that we can believe that there is very good reason to have these highly qualified professionals, and at the same time that there is a space for developing more program also in Europe.
And
yeah.
Also I was wondering if there are educations, trainings in English in non-English speaking countries like Czech Republic or here.
Yeah. There are, for instance, in Zagreb, there is Ph.D. program focused on prevention. It's interesting and completely new program. In Prague is Ph.D. program in English also. In Dresden, they have a wonderful Ph.D. program, and Gerhard Behringer, you probably know him. It's very highly sophisticated program, originally sponsored by Volkswagen, and they had a lot of money. But after Dieselgate, they have a lot of troubles. But it's a really perfect program on Technical University in Dresden. And of course, Mecca of addiction studies is UK, United Kingdom. And on King's College, John Moores University, Trinity College, you can find really highly sophisticated and very traditional addiction programs, of course, provided in English language.
And practice-based?
You
mentioned more PhDs.
Practice-based, just some of them. That's very good issue, and if you think about something like that, it's very good to check it and very carefully, because 80% of this program are just theoretical oriented. And by the way, wonderful program is in Scotland, what I mentioned. It's pretty nice. We have very practical oriented program, but for instance, a very highly sophisticated program on King's College, it's only theory, just theoretical oriented. It means that it's necessary to check it very carefully what they provide in reality. Yeah.
Thank you very much.
I thank you.
Questions?
Oh. Super. Thanks so much. I highly appreciate so many questions. That's a great honor for both of us. And Friday, 6 p.m. That's great. Thanks so much.
Thanks so much. Great talk, and indeed great discussion as well. So thanks again very much for coming. Also to the to lecturers and also for the audience, and I hope that we will soon meet in other occasions. So yeah, thanks for coming and enjoy the day further. Thanks.
Thank you. Thank you and have a nice evening.